Well, they're going to be bringing dinners in for everyone, but I think I'll just go ahead and give you a little bit of background. First of all, thank you for, you all have such busy lives, and so many of your evenings are taken already, so I really appreciate you taking the time to be here. This is a part of an effort to get as much input as we possibly can as we begin shaping our population health, I'll say program. It's really more than that. We have the Cottage Board. As you know, we're a not-for-profit organization. We have a volunteer board, 18 individuals who meet every month plus their committees. And the last couple of years, we've focused our board retreat on population health. And so I get asked a lot, what is that? And it's a phrase that kind of caught fire very quickly without really clear definition. And so we've kind of defined our version of it. And we are very used to providing patient care and patient health with people with traumatic injuries. And we partner with the county and with our teaching program and neighborhood clinics and others to do that. But this is really looking at the community as a patient and thinking, how can we diagnose what the healthcare disparities are in our community, whether they're by gender or ethnicity or income level, and we know that they exist on all fronts in that regard. How can we really understand what those challenges are? And then what's Cottage's role in partnering with others? Because we don't pretend that we can do all this ourselves, but partnering with the county, with the clinics, with VNA, with hospice, with the schools, with food bank, with other nonprofits in our community on a collective effort to implement interventions that get at, and I hesitate to say what it will be because we don't know yet, but it could be, because a very common problem is childhood obesity among Latinos. And it could even be broken down by young male or female below the 8th grade. And then you could get to, well, it's that issue, but it's at this particular cross street, or probably not zip code, it's probably too big. And so we're trying not to fast forward and pretend we know what the problems are. It could be immunization rates, it could just be transportation access to a primary care physician as well, or how can patients get into the county clinics, and ways that we could partner and help with issues like that we think could go a long way. So last fall at our board retreat, the board approved a change to our mission statement, and that's a very big deal for us. It doesn't happen very often. The mission statement is a driver for us, and it changed the words from providing superior care to our communities through our core values to providing superior care and improving the health status of our communities. And that means that if we're going to take that mission seriously, we need to do it in a very studied manner and to do it with our collaborators and our partners in the community, and we may not know who all those are. So we're starting this by doing, I think, a much better job than we've ever done before. I was telling Janet earlier at doing our community health needs assessment. It'll be a much more robust needs assessment than we've ever done in the past, down to the cross-street level. We're oversampling low-income populations to really try to get an understanding of this. And we're doing these listening tours, as we're calling them, with community leaders, healthcare providers, nonprofits, business leaders, to do that. These are not listening tours for you to listen to us. I'm going to stop talking pretty soon because this is a chance for really us, and facilitated by Bob McKenna and Allison are both here and have this expertise to help pull out of our community some really key themes and messages of things that we ought to be working on. And so we're building out our population health department. Monica Ray, who, because she is happily married, is moving to Chicago pretty soon. But we still have the benefit of her being here. Monica has headed up all of our community benefit programs. You may not know that we spend a little over $2 million a year on community benefit programs where we support other nonprofits in doing work that really complements the work that we're doing at the hospital. And Monica oversees that program with a committee at the hospital that makes those decisions. And Maddie Fry is an expert in evaluation. She has both her graduate work and her subsequent work has been in this area. And we think that that is a really key piece, that many communities who try to do this don't do that part of it well. So our thinking is that it's gonna be data driven. We will find out what problems do we want to tackle with a number of you, and then we're gonna evaluate those interventions and see if they're working. And so, did we lower the BMI? Did we increase the immunization rate in this particular community? Things like that. And so Maddie's going to help us with that. Not here tonight, and I'm sorry she's not here, is Elizabeth Majestic. Dr. Wada knows Elizabeth well. And Bill, I don't know if you've met Elizabeth. I think you have. She's she's not been here a year yet from the CDC. She's the Vice President for Population Health. And she's really helping shape our program as we move forward. Part of this also, I will tell you, came up today in our meeting with the education supervisors, which I was delighted that it came up, was the healthcare reimbursement world is changing too. That's not a driver for what we're doing right now, but it is, we do see us migrating from, hospitals refer to this as the move from volume to value, where we're not reimbursed for every x-ray we do, we're reimbursed for what kind of a job we do in helping a population take care of itself. So I think a lot of the things that we're working on to improve the health status eventually will work to our community's advantage and to Cottage's advantage if we're going to move into a world of financial risk in taking care of populations, which I believe that we should do. I think it's the right thing for us to do to help make healthcare as affordable as we can as well. So that's, you're going to be upset because every time I do this I'm going to talk longer. And so that's kind of the background on this. It's all leading up to, with this data that we're going to have this fall, which we will share very openly. We are building a Cottage Data to Go that the county will tap into, and the schools and the chamber. Anybody who wants access to this, it's very public information, and we want to support that. But we are, yeah, please do start your dinners. We are also holding in April a symposium, a workshop at Fest Parker, where we're going to bring people together to begin a community dialogue around what topics should we tackle first, what community challenges should we tackle first as a group of community leaders. So I just mentioned very quickly who are the people on our staff and also our facilitators are, and let's enjoy our dinners, and then Bob will help facilitate a dialogue that is going to be listening to your thoughts around really any of the above. I won't ask your questions for you because you'll do a job of that. And Bob also will explain to you. You might have noticed that there's a camera rolling right here, and so maybe Bob, as we dine as well, you could just explain kind of how we're going to use that. So again, thanks for being here tonight. We really appreciate your time.